Thank you. Welcome everyone to the Royal College of Nursing. I'm delighted to be here chairing this evening's event, and it's my pleasure to welcome you all, both RCN members and nurses more generally, but also members of the public. You're all very welcome here. This evening's event is for the launch of our RCN exhibition on nursing in the climate crisis. And now is a really important time for us to be thinking and talking about this. Before we actually start the main event, I have some housekeeping to do. So for those of you here in the room, because we're also being joined by many people online, there are no planned fire alarms this evening. If there is an alarm, we go straight through the back doors, past reception, and people will guide you across the road to avoid you being run over by the buses and the taxis. So please follow the RCN staff. Please don't go to John Lewis and disappear, because we don't know where to find you, and it causes us quite a lot of concern. There are 2 toilets, accessible toilets through Council Room and on the left. There are also toilets, if you go through the doors here, to the back of the hall by the lift and then down the stairs. For those of you online, in terms of Zoom housekeeping, you will be muted throughout the event, but please don't be concerned, because you will be able to have an opportunity after the talks are finished to ask questions, and we'll be using the Q&A function in Zoom for that. A member of RCN staff will be checking the Q&A function throughout the event, so if you have any questions at all, please use that function, and we will make sure that your questions are considered. So welcome. My name is Rose Gallagher. I'm the Professional Lead for Sustainability here at the Royal College of Nursing. And it's my role as a nurse to take the science, the evidence, and all the policy around sustainability and action on climate change, and to consider that through the lens of nursing practice. So what does it mean to nurses and nursing? We have some very eminent speakers tonight. They're all eminent speakers, but I'm going to take chair's privilege and just say a few words myself. This exhibition for me, and I've been involved in a number of exhibitions over the years, is unique because it's a contemporary exhibition. We're not celebrating or reflecting on the past as we have done on other occasions, but rather we're creating history. This is history in the making as we start to integrate our role as nurses and midwives to act on the climate emergency, which of course affects us all now and will continue to affect us in the future. As nurses and midwives, the health, safety and well-being of our patients, the public and the planet is deeply embedded in our personal and professional moral and ethical principles, our code of professional conduct, and how we deliver care. It's part of everything we do, and it's applied and relevant to all care settings, not just hospitals. The climate and ecological crisis will significantly impact nurses working in clinical and non-clinical roles as we design and implement care for those receiving care in their own homes and other settings such as prisons, long-term care facilities, maternity, paediatric, health protection and public health roles, just to name a few. As nurses, we recognise action on climate change is a long game. This isn't something that is going to change quickly or be resolved quickly. And it will be down to us, and also action by future generations of nurses and fellow health professionals to address. Today's launch takes place as the Conference of Parties, or COP meeting, takes place in Azerbaijan, with global leaders meeting to determine policy and action, including health policy, that will affect us all, even here in the United Kingdom. So today's launch also follows the recent Lancet Countdown report, which sadly didn't receive much media attention because of all the other global events taking place at this time. So tackling such a huge and complex issue such as climate change can only be achieved through multi-professional collaboration and multi-professional engagement. And therefore, I'm delighted to welcome our speakers for this evening, who will each bring unique perspectives to support us to nurse through the climate crisis. So I'd like to first introduce Dr. Richard Smith. Richard, it says you're a trustee of the UK Health Alliance. I think I need to promote you. Richard is the chair of the UK Health Alliance on Climate Change, and the Royal College is delighted to be a member of the Alliance. He's chair of the Point of Care Foundation, which promotes compassionate, dignified care, and Patients Know Best, and is co-chair of the Lancet Commission on the Value of Death. From 1979 to 2004, he worked as the British Medical Journal, at the British Medical Journal even, and was editor and chief executive of the BMJ Publishing Group from 1991. Richard, delighted to have you here.
Well, good. Well, thank you very much, Rose. Well, let me start by congratulating the college on the exhibition. I don't know how many of you have seen it, but it's very kind of modern and touchy-feely. It's an excellent exhibition. And Rose tells me it's going to extend to Edinburgh, and I hope perhaps you can lend it to some other colleges. Can I also thank Rose, who's made the most enormous contribution to the UK Health Alliance on Climate Change. And then I also want to thank the college, because we've met here more often than we've met anywhere else, because other colleges say, oh, we haven't got the money, or we don't know, we're full up. So we're very grateful to the college. So this is what I'm talking about. And this comes from the Lancet. And I think this is where we're at. Climate change and the ecological crisis are both the major threat to global health, but also the greatest opportunity to improve global health. If we do all the things we need to do to improve the planet, we improve our own health as well. So the UK Health Alliance on Climate Change is 10 years old. Rose has been on the executive right since the beginning. It has, we have 49 members, most of the Royal Colleges, certainly the Royal College of Nursing, which has been there right since the beginning. And we exist because this is the threat to global health. And we do all we can to mitigate the effects of climate change and also to encourage adaptation. And I have to say that, like almost everybody else, we've done very little on adaptation up until now, but that's our strategic priority for this year. But we also exist to emphasize the benefits to health of the changes we need to make. We have our members number over 1 million, and of course nurses are by far and away the biggest group. We need to be more prominent in the debate. I mean, last year's COP was the first one that had health on the main agenda. It needs to be there on every single agenda. And we're also working to support all 4 of the NHSs to get to net zero. This is a slide I use, which I think summarizes our predicament, and it summarizes the tensions that are going on in Baku in Azerbaijan at the moment. If everybody in the world live as people live in North America, we would need 5 planets, because people in North America are consuming far too much, emitting far too many greenhouse gases. If everybody lived as we live here in Western Europe, we'd need 3 planets. Now, as everybody here knows, and as every single nurse knows, we have only 1 planet. The only people who live sustainably at the moment, and it's not every person within those regions, the people in Asia Pacific and Africa, because many of those people are desperately poor. They don't have any access to electricity. I mean, the carbon footprint of someone in Malawi is about 200th that of someone in the US. And yet, as that big arrow shows, the people in North America don't want to move in the Asia Pacific direction. It's the Asia Pacific wants to move in their direction. So this is only possible if we shrink dramatically the amount we consume in high income countries, allowing lower income countries to develop. And also the high income countries are going to have to provide lots of support. And that's one of the tensions going on at the moment. And just to, we have the Paris Agreement from 2015 to try and stay below a global increase in temperature over pre-industrial levels of 1.5 degrees. We're not going to achieve that. I mean, it's apparent that that's not going to happen. It's slightly complicated because it's calculated over 10 years. And you can see that 2003 and 2024 at the top there, each of those lines is a year. Things are really beginning to accelerate. And this sort of summarizes what's happening in a sense in Britain. So that green line at the bottom, that's what we would need to do to reach 1.5 degrees by 2035. What's actually happening is the red line at the top. There has been some drop in emissions from the UK, whereas global emissions continue to rise. But there are two gaps. We don't have adequate targets. So that's an ambition gap. We need stronger targets. But of course, it's easy to have targets. The really difficult thing is to reach those targets and to implement them. And we have a substantial delivery gap. So there's lots and lots of work to be done. These are the ways, in which health is affected by climate change. Air pollution, which has the same, I mean, air pollution's been with us for a very long time. I grew up in the smogs in 1952. But now we have a different kind of air pollution, and that's killing 8 million people a year around the world. It's killing thousands in London. Violent storms, which you've been seeing, floods and wildfires, heat waves, which are getting steadily worse and lasting for longer and lasting through the night. Mental health damage that's here already, but also coming from floods and wildfires and destruction of people's homes. Extension of infectious diseases. The pandemic has the same roots as climate change, desertification, deforestation, food shortages. I think that's the one that may hit us the soonest. Water shortages, forced migration, and if we don't respond, then I think the ultimate way it could play out is through war. But this is the good news. There are substantial benefits to health from making the changes we need to make. If we make our homes more energy efficient and cheaper to heat, that'll improve our physical and mental health. If we eat largely plant-based diet, and a very small change can make quite a big difference, that improves our food security, our nutritional status, helps tackle obesity. So it's good for physical and mental health. Walking and cycling more reduces air pollution, means we use less fossil fuels, and is good for us physically and mentally. Community action, access to green and blue spaces. All of these things are good for the planet and are good for us. So how should we respond? Well, a response is needed at every single level. That's how I like to think about it. Clearly, this is a global problem. If we don't have an adequate global response, then it won't make that much difference what we do as individuals. But at the same time, we do need to change as individuals. We need to change rationally, nationally, in regions and cities. The health system itself needs to change, which I think makes this even more important for nurses and other health professionals. And then our organisational members, like the RCN, it needs to change. And we need to change as individuals, both professionally and personally. This, I think, is a GP I took from a friend who's a GP, and I think it summarises sort of where health professionals are at now. I think every health professional knows that climate change is real and it's happening now. People are seeing the direct impact, floods, heat waves, and they're aware of things they can do to make a difference in changing how they live, changing their diet, how they travel. Where I think there's variable awareness is just how urgent this is and how we need to kind of transform at every level, and the very severe risks if we don't. It's like, everybody knows that smoking is bad, but people often don't realize how bad it is. And I think it's a little bit the same here. People have been slow to make the connection with health, healthcare, and health priorities. And we have a duty to speak out on that. And I think they don't necessarily grasp their connection with their clinical role. What does it mean for me as a gastroenterologist or a nurse specializing in respiratory care or asthma or whatever. So just to show some of the things we do, I mean, we at the UK Health Alliance, we put together our manifesto right at the beginning of the year. So we were ready when the election came. And these were the 5 things we asked for: end fossil fuel dependency, ensure a healthy environment, transform the food system, meet international commitments, and transform health and care services. And we sent that to every single candidate running in the election. And quite a lot of them wrote back to us saying, yes, we care. Although we also got a lot of people from Reform saying there is no issue, there is no such thing as climate change, which is pretty disturbing. And then we have these commitments for our members, including the RCN. There are 11 of them. We would like them to do all of these things. So declare a climate emergency, develop a plan to get to net zero, report on it every year, change your food policy, campaign, change your travel policy. And we are monitoring how well people are doing. You can see all of these things on our website with a lot of detail behind them on how you can get it done. And with healthcare, if it were a country, it would be the 5th largest emitter on the planet. That's maybe a little bit surprising until you realize just the size of healthcare and the number of people working in it. Healthcare emits more greenhouse gases than aviation and shipping combined, again, because of the sheer scale of it. And the NHS accounts for 5% of all UK carbon emissions, which is about 40% of all emissions from the public sector. 1 in 20 vehicles on the road in the UK is related to the NHS, which again, is a little bit surprising the first time you hear it, but when you think of how many people work in the NHS, people travelling to and from work, people going to and from clinics, supplies being delivered. But this is what's happened. This comes from the Lancet Countdown. This is the carbon footprint of health systems around the world. And you can see they're almost all going up. And clearly this is crazy. This is the biggest threat to health, and yet health systems are increasing their emissions. And the one right at the top there is the US, which is actually accountable for half of all greenhouse gas emissions from health systems. A huge, very dysfunctional, very ineffective health system. As I hope you're all aware, the NHS in England is genuinely a world leader on this and has net zero targets that are written into law. So it must be net zero on all that it directly controls by 2040 and by all that it consumes by 2045. And this is the carbon footprint of the NHS, which is currently being updated. I just pick out a few things. You can see it's many different things. It's not one thing. About 2/3 of it is things that are procured, drugs and equipment and food and supplies. The single biggest component is drugs. And when you think that half of all the drugs prescribed in this country, as in other countries, are never taken, there's huge scope there for improving care and reducing cost and carbon. And this is the NHS plan for getting to net zero by 2045. And again, I'll pick out a few things. Again, it's many, many different interventions. There's no one thing that will fix this. It depends heavily on prevention and reducing inequalities, which luckily is a big emphasis of the government at the moment. But I have to say, I joined the BMJ in 1979, just after something called the Black Report was published about inequalities in health. And in the last 50 years, on the whole, I've watched prevention be constantly put on one side and inequalities get worse. A chunk of it is anesthetic gases and inhalers, and that's an example of where we have made progress. Clearly moving to a much more digital system where people don't necessarily have to travel to clinics as a way of making a difference. A lot of it depends on research and innovation. Nobody knows what a net zero health system looks like, and there's lots of work to be done there. And it's only recently that it's been possible to get funding to do research on climate change and health. And of course, it depends very heavily on working with suppliers. And if you look at the carbon footprint of a pharmaceutical company, about 2/3 of it is from its suppliers, which illustrates how everything has to change. This is a slide from the Centre for Sustainable Healthcare. And there's no better place to go and get lots of information on all sorts of ways you can change clinical practice. And this sort of summarizes their approach. So you're trying to reduce carbon consumption without reducing health, and maybe even with promoting health. So clearly the best way to do it is to reduce activity, more prevention, more self-care. And if you do have to deliver care, do it as efficiently and leanly as possible. Reduce the carbon intensity of treatment, so use low carbon alternatives, and think obviously about estate. So this is the kind of pattern they use for thinking about it, and it's a very helpful way to think. So this is my penultimate slide. So what I would really like to see happening from tonight is not only that you go and look at the exhibition, but you begin to do something. I'm sure many of you are doing something already. You can make a very small difference by changing your diet, by walking a bit further, driving a bit less, cycling a bit more. There's so many things you can do. So what needs doing? Well, there are thousands of things that needs doing. What is it that you are good at? What's your particular skill? Perhaps you're a respiratory nurse, or perhaps you're someone who loves cycling. Perhaps you're someone with a gift for cooking. But also, I think importantly, what is it that brings you joy? What's going to allow you to keep going on with what you're doing? And that, I suggest, is your climate action. That's the place to concentrate. And what crucially we know is that action begets action. So once you start doing something, you'll begin to do much more, and you'll feel much better about it. And here we are, my last slide. Elaine, the director of the UK Health Alliance, wouldn't forgive me if I didn't put this up. You can subscribe to our newsletter completely for free. It comes out every month, and remarkably for a newsletter, it has a 60% opening rate, whereas most newsletters have a 20% opening rate. So congratulations to the college, and I urge you to do something. Thank you.
Thank you, Richard. We'll take questions at the end through the Q&A function, and here in the room with microphones as well. So now it's my pleasure to introduce Clare Nash. Clare is a nurse and has been incredibly supportive of the work of the college, both through our work on sustainability, but also during the pandemic when we faced so many issues relating to PPE. Clare is the head of clinical procurement for 2 acute NHS trusts in the Midlands, and with a nursing career spanning over 30 years, she's witnessed firsthand how the care delivered impacts on the environment and is determined to amplify the voice of nursing through her work in sustainable procurement. Clare, over to you.
Thank you very much, Rose. I've used the step because I don't think I'll manage to get up without the step. Thank you very much for having me this evening. It's an absolute pleasure to be here. What a privilege it is to talk to you all about something that I'm so passionate about. So yes, I've been qualified 30 or so years. And way back when I started as a baby nurse, as many of you will have done, you've committed to adhering to the nursing and midwifery code. And one of those things includes preserving the safety of our patients and the public. And during this time, I do think we all need to question, are we genuinely been able to do that? And what can we do more of to make sure that we are doing that and that we're protecting the safety of our patients? I'm a proud nurse. I'm a very proud mom. I'm a doggy mom as well. And I absolutely love being in the fresh air and out and about in our beautiful UK countryside. And that's one of my whys. That's why I think it's so important that we're protecting the planet. But also, I think it's absolutely vital because climate change, as we've heard from Richard, is here now. And one of the things that I try to do when I go out and speak to my colleagues in my trust is try to find their why. Because if you can explain to them why it matters, they will do something about it as well. So another of my whys is I live in the beautiful town of Bridgnorth. It's got the River Severn running through it, and it's the longest river, as well as the, I've got to say this word correctly, voluminous river. So it's very full, basically. And as we know, with the climate emergency accelerating, the air is getting fuller and fuller of rain, and it's raining on the River Severn. So what that means to my town is that it regularly floods. That's really bad for our population, isn't it? Because we're flooding houses, it's really bad for the people's health who live in those flooded houses, but actually it impacts our town as well, because to get to my hospital, the nearest one, that road gets closed when the when the river floods. So it takes us longer to get there if we need urgent care. So it is impacting everyone in my town today. And that's another reason why I'm here sharing my work that I'm doing in my trusts. So I'm responsible for making the system worse, and I'm determined I'm going to make it better. And why I say that is because one of my roles is to make sure that the stuff we buy is safe for patients. But more importantly, I'm a clinical procurement nurse, so I get to decide what we buy for trusts from a green perspective as well, because clearly we're buying so many single-use products. We need to work out how we choose things that are greener. So one of the things I looked at the weekend was I ran some reports to see how much single-use stuff we're using. And I started off with something that is actually in the display cabinet downstairs. And you'll probably have seen them when you're out and about. So we talk about gloves a lot. But the other thing we use a huge amount of in nursing are those detergent wipes. And particularly since COVID, we use them everywhere, don't we, to decontaminate our work surfaces, keyboards. If you stand still, you might get wiped down with a detergent wipe. So I had a look at how many we were using to share with you today, and it's really shocking. So I'm glad you're all sitting down, and hopefully if you're on Teams, you're sitting down as well. So in my integrated care system, which is 4 acute trusts, some community services, some GPs, mental health trusts, and an ambulance service. I have to take my glasses off so I can read the number right. We are using, in our little ICS alone, 1.6 billion wipes, and they're made of plastic. And the ones I'm referring to, which I won't mention names, but they come from China. So you can imagine that if you multiply that by 42 ICSs, that is about, well, you can quote me on it, but I'm going to say it's an approximation of what we're using, 68 billion single-use plastic containing wipes to clean our hospitals. Just take a sip. Yes, Rupert, that's per year. So I think that's going to get progressively worse unless we do something about it. And one of the reasons I've picked on that is because in my baby nurse days, we didn't have single-use wipes. And I'm asking us today to think boldly to go back to what we used to do when we were baby nurses. And we used to have reusable cloths. And we used to have detergent that we used to mix. And I'm not advocating necessarily that that's going to work everywhere, because that's an additional pressure on extremely busy nursing staff and midwifery staff that we've got. But there are alternatives to that as well. So we need to look at alternative innovations that are coming to the market, such as hypochlorous acid that we know is really effective. And Graham Pike's in the room, who's an IPC lead and a strong advocate of that. And other things like UV. Now, that is what we used to use to clean really way back when, that UV light does decontaminate as well. So one of the roles I'm really keen to do is to look at the things that we use in ridiculous numbers to see how we can change that, and working with my nursing staff in my own organisations to see how we might make some of that work. But I've got another statistic for you. In our ICS, integrated care system, again, the same area, we use about 8 million single-use plastic syringes. Perhaps not too surprising, multiply that by our 42 trusts and 42 hospitals, and that's about 1/3 of a billion single-use syringes. Now, I'm not suggesting we start to reuse syringes. Clearly, that's not going to work. But what I am asking you to all think about is, does your patient really need that medication you're about to draw up? Could you give that orally? Do you really need to take those sets of bloods for that patient? How do we reduce the use of the single-use plastic things that we use every day? As Richard stated, the NHS carbon footprint, about 62% is the stuff we buy, and probably about 20% of that is related to some of these items that I'm talking about. And the other thing I looked at on Sunday was the number of things that we purchase in my trusts that have a badge reusable in the description. Less than 1%. Now, I need to dig into that data a little bit further, but what it tells me is that even if it is reusable, we're not advocating for that, and that manufacturer is not selling us it as if it is reusable, because actually that's not great business sense. So what we really need to do is work better with our suppliers to make sure that the products that we purchase are safe to reuse and badged as that, and that we actually do keep that in circulation rather than putting it in the incinerator or in landfill, or sometimes the pulp products, for example, getting flushed into our sewage system, contributing even more to that awful water issues that we know that we've got in the UK as well. The other thing I've done is I've written a couple of articles that we will reference afterwards for those that are interested, but there's one on what nurses can do to reduce single-use PPE, and Rose touched on that. We use billions of gloves every year. So there's some work that you can go and have a reference to see what you can do differently around that PPE. And I don't want to rain on Catherine's parade. She's going to talk about PPE shortly. And then the other thing that I'm developing is a tool that it will enable frontline nurses, clinicians, procurement folks to choose greener. So I've developed a tool called Critico Care, which will allow you to put some data in about the products that you're purchasing so that you can compare which one's greener. And that's hopefully going to come out later this year, and I'm on a programme to deliver that. So I'm happy to talk about that with anyone that would like to know a little bit more at the end. So on a positive note to end, there's lots of stuff to do, isn't there? When I've just given you those numbers, but working together, we can turn this around. And I think, that's why we're all here, isn't it? If we all go back after this evening and talk to 1, 2, 3 other team members about this and help them find their why, then we'll be able to move forward and we'll be able to get much further faster. There's over 800,000 nurses and midwives registered in the UK. So this unique and thought-provoking exhibition is full of examples of how we can work together better to go further faster in tackling the climate emergency. So at the opening of this exhibition, I'd like to empower you all. I'd like to urge you all to use your collective 800,000 strong nursing and midwifery voices and speak truth to power. Folks won't always like you for it. Yeah, we're used to it probably as nurses, aren't we? But that's fine. But if we can share our knowledge and influence our colleagues, our patients, our families, perhaps mine are fed up of hearing about it, and the wider population, we can make those small changes that will add up, and we can continue to hold ourselves up to the light of our NMC code. Thank you very much for listening.
Thank you, Claire. And I do actually remember vividly when wipes came into use en masse in my organisation as a quick fix that very quickly became normalised. And we're very good at introducing new things and looking for solutions to problems. But the risk is that we normalise these, and before we know it, it's part of everyday practice, and then it's very difficult to move away from that. So thank you, Claire. We'll come on to questions afterwards. Catherine, so it's my pleasure now to introduce you to Catherine Townsend. And Catherine is a professor of fashion and textile practice whose work is aligned with sustainable transitions in the Fashion and Textile Research Centre at Nottingham Trent University. And you can, again, through the exhibition, look at the work that Catherine has been doing for us. Over to you. Thank you.
Hello, lovely to be here and to see things in the exhibition. You probably recognise this image, which is quite iconic, perhaps the most iconic piece in the exhibition. And I just want to tell you a little bit about how we got there. So a brief overview. In early on in the pandemic, one of my daughters said, "Mum, can we make some scrubs for Scrub Hub, Nottingham?" And I thought, yes, we can do that. We have a machine, it's 60 years old, but we can get it out. It was my auntie's and she was a nurse. So anyway, we made some scrubs. And in doing that, it made me think about the materials. By handling materials, making some sets, made me think about what are the other garments that nurses are wearing, or doctors or healthcare workers in general. And so I did a little bit of research and found out that isolation gowns particularly were not working that well. And they were, you know, scrubs were needed, but isolation gowns were being imported offshore. A lot of them were one size, they weren't fitting well, and they were heating on the body. So there was a lot of issues. So I thought, I'm going to write a bid and see if there's something we can do about this. So I wrote, as you can see, rapid response, ideas to address COVID, and I got a modest amount of money, I would say, to try and change things. And basically I got a team together, and what our aim was to create a reusable gown that wasn't going to go be incinerated after one wear, was going to be more comfortable, and that was going to be better for the environment. So we wanted to base it on healthcare workers' experiences so that it wasn't just what we thought it should be. So we did a survey with not as many as we'd have liked, but only about 130 from Nottingham hospitals, but replied, because it was really hard to get any kind of interviews or responses. But we did a illustrated online survey, got enough responses, and we also interviewed procurement leads in different hospitals in the East Midlands. And we created a gown, we did some wearer trials, and basically that gown is about to be licensed, but the repurposing, refashioning goes on, because this is the team. So you can actually, oh, sorry, it's a little bit, but you can read the things that have come out of the research here, the different kinds of outcomes, research outcomes. But basically, what we found in designing the gown was that, unfortunately, after 75, up to 75 washes, the legislation dictates that it has to go, it cannot be used again. So we thought we'd made something really good. And here it is, and it just looks really like every other isolation gown, and it's downstairs. But actually, we have it on good authority, on nurses' authority, that it is actually more comfortable and it is cooler. And, you know, we tweaked the design and we made the gown in collaboration with a company called ANSI Limited in the East Midlands. We also collaborated with a laundry provider, Synergy LMS. So we had this kind of model within the East Midlands, so that we were having the gowns made locally and they were being laundered locally, because, as you all probably know, there aren't many laundries now, and that had prohibited reusable gowns being used in a lot of hospitals during the pandemic. So we devised the gown, finding that we'd made a product that then was going to add to landfill or being left sent offshore. We devised it within, this is a speculative circular model, but we are now trying to develop the later phases of use. So we've introduced reuse in patient care, so that the gowns could potentially be customised and reused for tests such as colonoscopies, different things like that, because I don't know, you know, sometimes you're asked to put 2 gowns on because the single gown doesn't actually cover everything. And these are quite voluminous, but, you know, we would have to customise them. They can't just look like what have been worn by nurses or surgeons. But then we also wanted to reuse see what creative potential there was for fashion and textile designers to reuse this material, these garments or the materials that they are made of. And then the reuse 3 is for the fabric to be recycled, and that is happening, and for it to be created as fibre and then rewoven and made into another gown. So potentially we could have a model where it's like a gown to gown circular model. So to test the reuse of the fashion and textiles, I started at Nottingham Trent University with my colleagues and students because I thought they could have some good ideas, and they absolutely did. So we did a series of repurposing workshops, and there were prizes for students for the best garment, the best textile, the best mood board, but also quite a lot of staff from the fashion department joined in too. So that was really, we came up with a lot of experimental pieces. And then I invited some fashion designers to join, and they came up with these garments, and they had more time, and they had some different ideas that they aligned to their commercial products that they are currently making. And you can see 1BC, they're a Nottingham company. They joined all the sleeves and spiral cut them into the outfit. Clements is a London-based company. Actually, Charlotte Allen runs that company. She used to be one of my students at BA and MA, and she created a garment based on her current collection. You'll have seen the gown of care downstairs. That's made of 12 garments, used garments. The designers, Cunnington and Sanderson, they just wanted to keep the gowns whole and use as many as possible and drape them. And so it embodies the sense of use, and the fact that it's called the gown of care reflects what those gowns are for, and the nursing profession itself. And GeForce, they even added knitwear, and that's the caduceus, which is a symbol for healthcare, I believe. It's anyway, they called it of good omens and looked at the meaning of national health. But these are ideas. There will be more. We want to work with different groups, artists, possibly prisoners, for helping us to deconstruct, reconstruct. But I think there's a lot more to be done in this area. Thank you.
Thank you. And I'm sure, speaking to most of the room here tonight, the appreciation for cool, loose clothing when you're working is something that cannot be underestimated. Our final speaker, before we go into Q&A, is Rupert Read. Rupert is co-director of the Climate Majority Project and Emeritus Professor of Philosophy at the University of East Anglia. He is the author of several books, including This Civilization is Finished, which in fact I got for Christmas last year, and Parents for a Future, Why Climate Breakdown Matters, and Do You Want to Know the Truth? The Surprising Rewards of Climate Honesty. Rupert, the floor is yours.
You mean the world? The whole world is vulnerable to this? This is truly a global emergency? Yep, that's about what we mean. That's about the size of it. And given you've decided to come here tonight, you may well already be aware of this, but colleagues, I have to tell you, the situation is pretty grim. We've just had a climate denier elected president of the United States. We've just had an autumn of absolutely unprecedented worldwide flooding events, which is still going on. We are in really, really serious trouble. We are deep in the age of consequences. A key consequence of this, which I want to offer you here this evening, is It is no longer possible to think about this crisis from the perspective primarily of decarbonisation. We have to take seriously climate adaptation. What does climate adaptation mean? It means dealing with our vulnerabilities. It means responding to impacts. It means preparing for future impacts, which are going to go on getting worse forever unless and until we do succeed in decarbonising. So when you think climate action now, don't just think decarbonisation. You've got to always think adaptation as well. You've got to always think about resilience and preparedness. You've got to be aware, for example, as I'm sure many of you are aware, that Guy's and St Thomas's almost shut down during the 40-degree heat wave a couple of years ago because its IT systems and other cooling systems could not take the heat. And we're just getting started here. Sorry, we're just getting started with this crisis. This is not something which is here today, gone tomorrow. This is something which is going to define all of our lives for all of the rest of our lives. And for most of us, possibly all of us, it's going to go on getting worse for all of the rest of our lives. So that's climate honesty. What are the surprising rewards of it? Well, the most important one is if we actually face up to this stuff, we can start to do something about it. There's a more interesting way of thinking about this reward, though, and it's relevant to a lot of you, and it's this. So we have a huge mental health crisis, epidemic, in countries like this one and across the world, especially among the young, but also more generally. And as we enter deeper into the climate crisis, people are going to be subject more and more to climate depression, climate despair, climate anxiety. And these people will need help. And a lot of you come in there. But there's something very important to understand and to always remember about these emotions. Unlike perhaps some other mental health conditions, these responses are rational. If you're not sometimes scared, then you're not paying attention. Right? Climate anxiety is a rational response to the situation that we are in. What we need to do crucially, and this is one of the things we're trying to do in the Climate Majority Project, working with educators and others, what we need to do crucially is resource people to process these difficult emotions and help them to understand that if they're experiencing these emotions, that's because they're awake. And actually, more and more people are going to experience these emotions. If you, probably many of you like me, have had whatever, appalling climate nightmares or serious episodes of climate depression or climate anxiety. If you, like me, are in that category, you're one of the vanguard. There are going to be a lot of people following you into that condition. And this is super relevant to how we think and how we rethink mental health provision in this age. Just going to say it one more time because it's a bit counterintuitive. These kinds of conditions that more and more people are going to have are not pathological. They are rational responses which need to be supported and resourced. And the more they are, again, the better position we get into in terms of actually coping with these impacts. And that, again, is a form of adaptation, right? Adaptation is not just about building flood defenses. Adaptation is a whole social and inner phenomenon that we need to start to take seriously and resource a lot more. So that's one of the ways in which folks in this room and folks watching are peculiarly and spectacularly relevant to the times that we're in. I now want to mention another, which is even more widespread in general, which is true of all nurses, all healthcare professionals. Let's come at this in the following way. So we've seen this wonderful exhibition with, for example, PPE in it and questions about, look, can we reuse PPE more and so on and so forth. And these questions are important questions. Why are they important? They're important for obvious reasons which have been discussed. But there's another reason that they're, in my opinion, even more important. And it's this. Healthcare professionals are role models. The closest we now have to a national religion in this country is arguably the National Health Service. Nurses are a profession with enormous public respect and love. The reason it really matters whether you have reusable PPE or not, or all the other things we've been talking about, is not, I would say, primarily because of its direct carbon and material impact. Of course that matters. Of course it adds up to a large amount. The real reason it matters is because people look to you, and you can actually leverage that potentially to have an enormous effect. If nurses and other healthcare professionals were to get systematic in their jobs, in their public personas, in saying, look, this climate crisis is a healthcare crisis. It's going to overwhelm us unless we get serious about it. You have an unprecedented and to a large extent, I would say, still here, untapped potential power here. So a key message I want to bring you as nurses here this evening is, don't go away from this thinking something like, okay, yeah, so the climate crisis is really significant. I'd better do a bit more ethical consuming, eat a bit less meat, and on the quiet reuse some of my wipes more than I did before. Right? If you're going to reuse more wipes, don't do it on the quiet. Do it in the public gaze. Make a point of it. Make a story of it. Make this something which people cannot ignore within the profession and beyond the profession. Talk about it with your patients, for example. You know, why does this matter? Why are you doing it this way, etc. Right? And whenever possible, talk about it in any possible public forum. Because to say it again, probably your most important role in this crisis is not the direct role you can play in reducing carbon emissions. It's the indirect role you can play in being loved and respected healthcare professionals who are uniquely, and perhaps uniquely in the world, in this country, loved and respected and icons of care. And healthcare is, in its broadest sense, is fundamentally at risk and fundamentally potentially beneficial from the climate crisis, right? Going back to what I said a few minutes ago, think about the way that we can repurpose our understanding of care and of health in relation to mental health through rethinking where we stand in relation to this crisis. What is it to have a sane relationship to this world? What it is to have a sane relationship to this world at this point in history is sometimes to be worried and to be scared and to naturally move along with others to do something about it. And when you move along with others to do something about it, you potentially have profound power because of your role, because of the respect in which you're held, because of the way in which you are icons of care and people care about and love you. So my final point would be this. I run a thing called the Climate Majority Project. And what we try to do is to provide a rallying point and a network and an umbrella for all sorts of people in all sorts of different professions, places, etc., who are trying to do what they can to find their unique leverage on the crisis. And the most important thing about the Climate Majority Project is not what people like me are doing, the project bit. The most important part of it is the climate majority. And who are the climate majority? You are the climate majority. If you're in this room tonight, if you're watching this, you are very definitely part of the climate majority. What our theory of change is that what we need is nurses and doctors and playwrights and sports people and insurers and churchgoers and people wherever they are in their mode of life who have potential leverage and power in relation to that crisis. And that eventually means all of us. But some of us have more of it than others. To use that power, to use that leverage, to make the most difference that you can. And I would venture to say that when you look back at your life at the end of your life, and perhaps if you're fortunate enough to look back at your life at the end of your life with a child or some other young person who is important to you, they will be aware, and you will be aware, that it's highly likely that at this great time of testing, the most important thing in your life will be, what did you do when you knew? And make sure that that isn't just, I flew a bit less or whatever, right? That's great, but it's not the most important thing you can do. The most important thing that you can do is almost certainly be nurses addressing and role modeling how to respond in a time of crisis where the whole future of the world, and that means the health of everybody and of all of us and of all of our descendants, is in the balance. And that is the sense in which you very really do mean the world. Thank you.
Thank you very much to all our speakers this evening for excellent presentations, each addressing different areas associated with our climate, health and ecological crisis. So what I would like to do now is invite our speakers up onto the stage so we can have a short Q&A session. If you'd like to come and join us. For those of you in the room, we will have some roving microphones. Now is your opportunity, and for you online as well, to perhaps ask some of the questions that you have always wanted to ask, but perhaps haven't had the opportunity to do so. I am looking at my colleagues to see, actually, first of all, we're going to flip things around. Do we have any questions online? So I'm getting a no. Okay, so for those of you online, if you have any questions, please post them in the Q&A panel. We have a question here in the room. Could I ask you, please, to give your name and where you work? Thank you.
My name's Lola Oni. I don't work anymore. I've got the joy of being not too long retired, so everybody don't get too jealous. And I'm a member of a fellow of the Royal College of Nursing. My question really relates to which part you think the countries that don't contribute very much emissions and contribute to the problem that we have at hand, how do you feel they will respond to this call for action? Because, you know, their response in Africa and Asia will be, well, we're not contributing to it. What's it got to do with us? You guys go and sort yourselves out. You know, how would we engage the countries that are not actually contributing to the problem? How are we going to engage them to participate, one, in the discussion, and two, in finding a solution, and three, in taking the action that you feel they need to take, if any?
Thank you. An excellent question. Rupert? Yeah, and then Richard.
Yeah, thank you. It's a challenging question because it's a challenging situation, right? So I've got two things to offer in answer to it. The first is that to some extent, it appears at present as though a lot of those countries will not rise sufficiently to the challenge. I mean, nowhere is rising sufficiently to the challenge yet. Some places are doing even worse than others. That has to change, but until it does change, it comes back to a point that I started with. We have to take climate adaptation really seriously. Our lives are going to be defined by this. The material conditions that we're working in are going to, on balance, get worse now for a very long time to come. And that is the truth. People haven't wanted to face that truth, which is one of the reasons why people have been so focused for so long on decarbonisation, because people have been thinking, oh, maybe we can just solve the problem. It's not going to pan out like that. My second point is, it is very important that we in this country try to offer some leadership if we want other countries to do the right thing. There's a number of reasons for that. So one obvious reason is that we are a relatively wealthy country. But there are more specific reasons. So if we go back into our history, we started it, right? The Industrial Revolution started here. We started this mess, and we've got more historical responsibility than any other country. If we think about where we are in the present, Britain is a small country by worldwide standards, but there are some respects in which we punch way above our weight. So, for example, 15% of all fossil fuel funding passes through the City of London. So that's a way in which we punch way above our weight. We punch the rest of the world. We punch future generations. And we need to change that if we're going to be in any position to lecture other countries. And thirdly, even today, it remains true that some other countries do look to us to a certain extent for leadership. We have been leaders in terms of climate legislation. We have been leaders in terms of climate movements. We in the Climate Majority Project are hoping to continue that path. And there are countries with historic ties to us that are like, what are Britain trying to do about that? Have they got something I can learn from? Are they setting a good example or not? We need to take all those things seriously. So actually, we're a small country globally, but there are a number of respects in which what we do matters, and we need to do the right thing.
Thank you.
I mean, I think, ironically, it may be almost the opposite of what you say. I mean, I think if you were at COP, you'd find that there are leaders of low-income countries there in large numbers, because if you look at a map of who is suffering the most from climate change, it's people in Africa, it's people in Asia, it's the reverse. I mean, often when I give these talks, I show a map who produced all these greenhouse gases. As Rupert says, we did, the US did. Who suffered? And if you look at Africa, you can hardly see it. Almost no greenhouse gases were produced from Africa. The only place that did produce some was South Africa. But if you look at, well, who's suffering the most, it's exactly the reverse. So actually, I think the problem is not so much to get Malawi or the island states to say we need to do something about this, because they see the problem every day. It's more in some ways to get places like the US and to take it very seriously. To be positive, I mean, WHO, World Health Organization, has now made this a priority. And as Rupert's saying, we recognize now that resilience is the most important thing. And actually, if you are in Malawi, you potentially have tremendous advantages, because the trouble is we've got a huge, in many ways, dysfunctional health system, that's all about sickness and not about health. If you're in Malawi, and I spent a lot of time in Bangladesh, a country that's very threatened by climate change, you actually have an opportunity to do it very differently, to design a health system that's not the copy of that crazy system that I showed you in America with those enormous emissions and very bad outcomes. You have an opportunity to do something different. And WHO, to give it its credit, is leading on this. And also its low-income countries pay a lot more attention to WHO than do high-income countries. So I think there are lots of reasons to be optimistic. And this is very much an issue of justice. And that's certainly how a lot of young people see this whole issue, through the lens of justice. The people who created the problems at the moment are suffering the least. The people who are suffering the most made very little contribution to the problem.
Thank you. And certainly from a nursing perspective, we're looking at this as an international issue where globally nurses come together to talk about how we can all do that as a global profession. I thought I saw a hand. Oh, my goodness. There we go. Marion?
Hello, thank you everyone. My name is Marion Lynch. I'm a nurse and I've been a public health specialist all my life and a climate activist in how we use the arts to help. So we know social change comes from combining our science lens with our arts lens. And we fail in health when we just go down the science lens. With fashion and other ways, nobody waits for terms of reference and a decision committee. Fashion fads happen through our social movement. So how can we, as health workers and health designers, really learn from the arts, where social movement and creation makes things more acceptable and sustainable in a way that we've never succeeded in our science-minded health systems? It's to Catherine, really.
Catherine, you?
Well, I think that's quite hard. I think we have to embrace, like you say, we've had a very much a science lens. Research has been like that. It's all been, scientific, quantitative data, in a way linking to the carbonisation argument. And I think we have to look at more creative, qualitative, I don't like the word data actually, but information, experience, impacts, which relate much more to how humans interact. And understand things. So I think we have to rethink how we tell the stories of what difference we can make. I'm a designer, you know, I'm not a scientist. So that's the only way I can tell a story about it. So yeah, I think we have to embrace the arts. Obviously, we still need the science, but you know, let's balance these arguments more and also show people numbers don't mean anything always, but images of, you know, floods, devastation really should mean something. So I think we can use the visual power and the tactile power of art to change things.
I'd like to just add to that I mean, I don't watch EastEnders and Emmerdale and those kinds of programmes. Occasionally watch Casualty, but has anybody seen those themes on TV? Well, I haven't. I know maybe because I don't watch it, but I think I would have known about it if it was on there. And I think that's also a really good way of using the arts, because actually, you know, could we write I love musical theatre. Wouldn't it be great to have a musical theatre about the climate emergency and what we can do in health to try to change that? And I think we need to learn from you as well, actually.
So we, Angela Hayes, who is now with Sustainable Healthcare, is a nurse, and her sister wrote for the TV drama Doctors, and there was a climate activist called Angela Hayes in TV Doctors. So us as nurses get into all kinds of spaces. So yeah, we are getting there, but we need to influence those script writers to understand the narrative as well. But she appeared in our webinar today. So
I'd just add that this might also start with people telling their stories, you know, like I would love to hear more from nurses, etc., who've been involved in things like what happened in Guy's and St Thomas's 2 years ago, or various flooding incidents and disasters we keep having around this country, etc., etc., etc. I think that could start to get quite powerful.
Thank you. And don't forget, I'm just going to quick plug now. We have an opportunity to influence the Darcy report through stories, through language. The RCN will be doing a response to the Darcy consultation, but it is an opportunity to think about how we start to change that narrative with politicians. It is starting with the COVID inquiry, actually, those impact statements, those videos and testimonies around the impact of the pandemic are the ones that people remember. They don't remember the 100-page evidence statements full of number crunches. So it's incredibly powerful. I saw some more. We have a question online.
Yeah, we've got a question from Mark, who says, student nurses often have the opportunity to undertake an overseas placement as part of their nursing course. Are these opportunities to raise the importance of sustainability?
Yeah. Do you want me to take that? I can see Claire nodding. Yeah, absolutely. There are all sorts of opportunities where nurses can engage, take sabbaticals, do secondments, whatever it is, overseas. And actually, one of the best ways of learning is to see how others do it and then to bring it back. We have a huge amount to learn from developing nations. I take my hat off to places like India, who, because they have come up with some really innovative solutions to the same problems that we have around record keeping, vaccination records, things like that. But because they don't have the resources, somehow they are much better. That we tend to tie ourselves up in all sorts of knots here. So I would say, yes, if you have the opportunity, take it. Absolutely. Yeah, please, at the back.
Hi, thanks for the talks. They're really great. My name's Izzy and I work in health communications and sustainability. And I was just wondering if you've seen any great examples of doctors and nurses and other healthcare workers not just taking on sustainability messages, but actively furthering climate action with their messages about health. And if you've seen any great examples that really worked well.
Do you want to take that, Richard?
Well, I think you can see action in all sorts of ways. I mean, I often use the photograph of a whole lot of doctors sat on the ground outside Downing Street. And I think one of the things we need to realize is you need every kind of action. So there is a role for health, for Extinction Rebellion, which, you know, Rupert was part of at one time. There's also role for an organization like us, which in some ways is a very ultra respectable organization. I think we need all of these things. To pick upon a particular example, I mean, Rupert talked about, and I agree with him, I think the biggest role we can play is because health professionals are so trusted and so respected. Nurses, I always remember more so than doctors, which I think it's very important for everybody to know. So you do have a tremendous opportunity to influence people. And I think a lot of people are very nervous about bringing up climate change at all when meeting with a patient. They think, you know, this is political, I better stay away from this. But Matt Sawyer is a GP who for years has been talking about climate change in consultations with patients. He doesn't start with climate change, but if someone comes in, for example, with a respiratory tract infection, one of the commonest things you see in general practice, in some ways, it's very strange not to talk about air pollution. I mean, oddly enough, often doctors don't. They'll always ask about smoking, but they won't ask about air pollution. And yet you really should. You know, that's killing tens of thousands of people. So you need somehow to bring it in, and then it's quite natural to move on. If you've got someone who's suffering from, you know, cardiovascular disease, another very common cause, it's quite natural to talk about diet and how that can benefit the planet as well as benefiting you, talking about exercise, people with mental health problems, talking about green spaces and how that can help them and maybe more effective than taking drugs. There are lots and lots of opportunities. And if you start from the patient's problems, it can get to feel quite natural. And, you know, Matt's been doing it for years. It feels very scary to people to start with. But once you get used to it, and, you know, then, as Rupert says, you're turning people, you know, you're actually, in some ways, you're putting them into the uncomfortable space that I imagine most of us live in, where we do realize just how serious this threat is. And maybe I could just, following on from what Rupert said, one thing that I often talk about is back in the 50s, you know, before people recognized the dangers of smoking, something like 70 to 80% of doctors smoked. I don't think it was such a high proportion of nurses. And then when all the evidence became available, it dropped from 80% to 20% in a very quick time. And this provided a tremendous opportunity for a study, the British Doctors Study. There's also a British Nurses Study, which demonstrated how when they changed, their health greatly improved. But most importantly, they gave an example to their patients. So I think it's a good example of how health professionals, through changing themselves, can make a change happen.
Yeah, and that's exactly the kind of thing I have in mind in terms of role modeling. Yeah, and, you know, to come back to this key point about the climate crisis, which the Lancet and others have been dwelling on for years, the climate crisis is a healthcare crisis. It is going to fundamentally challenge a number of aspects of health that we have been able to take for granted until recently. And, you know, who better than nurses and doctors to speak out about a healthcare crisis?
I'd just like to mention a couple of colleagues. One's in the room, actually, Emma. So I think in terms of what nursing has done is they've seen the problem, they've tried to tackle it locally and done fantastic jobs. For example, one of my colleagues started off in ITU, saw that they used single-use plastic cups and got rid of them. She wasn't very popular, but now everybody can see where she's coming from. She's done lots of other projects like reusable shower gels. Emma's done a huge amount of work as well in her area of expertise, and they both now work for NHS England, influencing and inspiring a whole new group of nurses. So those small actions that seem small at the time, they're really not, because like you said, it demonstrates how much you can do by just sharing that knowledge, and by being able to share that makes you a really inspirational team. So thanks to Emma and Ria in NHS England for setting.
Thank you, Claire. do we have one last question in Lucy? Okay. Final word from Lucy. Do we have one online as well? Okay, Lucy, and then our final question.
I'll be very
online.
quick.
Yeah.
So I'm Lucy Brown. I'm the clinical delivery lead at the Centre for Sustainable Healthcare and a nurse. And I'm really proud to work with Angela as well, who's recently joined our team. So we're trying to cajole the nursing community and educate them. My question is to all of you, obviously with like-minded people this evening. I find it quite frustrating that our regulators aren't taking it quite as urgently as I would like them to. And I guess I would love some advice from all of you as experts. How can we get the CQC and the NMC to really embed this in everything that we do so that we can really see rapid action that we so desperately need?
Any thoughts, Richard?
Yeah, we've had a lot of interactions with the GMC, which I must say have been rather disappointing. We wanted them to write into duties for a doctor that, you know, thinking about sustainability was a fundamental duty. There is something in there, but it's rather weak. Allied health professionals regulators have been much more responsive. So we haven't done really anything with the CQC, and in fact, it was brought out to me the other day that we ought to be, that's a place we must be putting some effort. But we've had quite a lot of interactions with NICE, because we regret that NICE, you know, when they're introducing something into the NHS, they look at effectiveness, they look at cost. They don't look at the environmental impact. And well, as you know, people at CSH have been saying since 2015, you really ought to do this. And they've sort of said, yes, we should do it, we ought to do it, but it's just too hard. But we've said, well, that's just not really acceptable. And I often use the example of desflurane, which, you know, people have got a lot of credit for stopping using desflurane, but desflurane has about 300 times the impact on the atmosphere that carbon dioxide has. And it has really minimal advantages over existing gases. As one anaesthetist said to me, well, it's just good for lazy anaesthetists. And so I think it's a classic example of something that never needed to be used in the first place. And yet, and it's a classic example of where NICE could do something. And we have a meeting with them next week or the week after, because they finally agreed to see us. We wrote them a rather aggressive letter that, yes, Rachel signed.
Is there something we could do together to kind of speak to the CQC and the NMC and kind of call for as a collaborative? I think it'd be really amazing.
Yeah, there's lots of conversations going on within nursing, as you know, around the NMC and how that fits with our code of practice in a way that enables that regulation to be done as it's intended to be done, but also how the messages get across. So absolutely for that. In the interest of time, sorry, Lucy, I'm going to go to our last question online quickly.
Yeah, perhaps this is quite a nice one to end on. It's from Lisa. What keeps you all hopeful working in this space?
Oh, okay. Catherine, start with you.
I think going back to what some of the other speakers have said, do what you can and try to make a difference, you know, even a small difference. And when you can see the impact of that, it keeps you going. Yeah.
Thank you. Rupert.
Well, I'd say what keeps me hopeful is all of you lot. And I'd also say what keeps me hopeful is the silver linings. So I mentioned one quite prominently, right? We have an opportunity here to kind of rethink mental health and mental ill health in quite a fundamental and interesting way. The terrible series of emotional difficulties that vast numbers of people are going to be going through over the next generation or two that are going to impact upon all of you in your professional lives as well as your personal lives, and some of you, especially if you're in that field, are an opportunity for coming to a whole new, which is understanding, which is also an old understanding of our relationship to each other and to the world, to the earth. So when we think of emotions like anxiety, depression, despair, normally we think, oh yeah, well, obviously those are bad things to be avoided. wherever possible, and you can get stuck in them and drown in them. And of course, all these things are in a sense true, but there's this other fascinating, terrible truth that if we are able to inhabit it properly, will be enormously powerful. So I draw hope from the fact that disasters have silver linings, that difficult emotions have silver linings, that the enormous trial that we're about to go through could be the making of us.
Thank you. Claire?
I think for me, what keeps me hopeful is around looking at what I can actually influence and control, and trying not to get too worried about the things that I can't do anything about. So I think there's something there for us all. What can we do today that will make a difference, and hold on to that, and you know, keep being mindful that you are making a difference just by doing those small things, and you are influencing others in doing that. Because one of my colleagues said to me yesterday, when I'm not in a meeting with her now, she can almost, well, I think she can hear my voice in her head going, don't forget to ask about the green agenda. And so I just think it's that chip with your colleagues that eventually will resonate with them, and they'll do it as they'll be doing your job for you. So I think that's what keeps me hopeful, is just staying positive and sharing that that annoying little voice in their head.
Thank you.
And what keeps me hopeful? Well, one of the things that keeps me hopeful is young people. I had the privilege recently of speaking to all the fellows. They're clinicians from every part of the NHS, you know, nurses, pharmacists, doctors, radiologists, and about 60 of them. They take a year out and they go and work in things like the CQC or in NHS England. And I had a chance to speak to them all. And I suggested, you know, maybe they would like to do some kind of project around all of this. And I got contacted the other day, and about 30 of them would like to get together to do something. And I found that very kind of inspiring, and I'll do everything I can to help them to be able to do something. I think, you know, it's young people who are going to be most impacted by this. And understandably, they're the people who care the most and can really make the biggest difference.
Thank you very much. So it falls to me now to once again thank all our speakers, to thank you in the room and those of you online for joining us tonight. We're going to close the event here now, and we have about 20-25 minutes to explore the exhibition, some nibbles and refreshments outside with electric carriages at 8 o'clock, because that's when the building closes. So thank you very much. Thank you.